So as far as, I was at a meeting this week, earlier this week, with a professional development for our principals in the city of Providence. They're very enthusiastic. It was great to read on the front page today, Commissioner, where teachers are going door to door in the city of Providence, and that's happening all over the state. The enthusiasm for this year is so important, and that's why the messaging tonight, not only on education but also health from our health department, is so key to in terms of making sure we have a safe and very successful school year. So we're confident the upcoming school year, because our team that has been undertaken across all levels of government and across the cities and towns are ready and prepared for you and your family and your children and your households. So I have personally toured over a couple dozen schools in the Providence, and I intend to get out with the commissioner and schools throughout the state of Rhode Island as we reopen. I'm amazed by the passion that's there in terms of the leadership, in terms of the teachers and the parents who are ready to come off a very difficult year into one that is going to be tremendously successful. So if you're a parent or of a student from Providence, you're listening tonight, you can be assured that you're going to have a fantastic school year. And anywhere you're listening into the state of Rhode Island, you're going to have a great school year. And that's what we're here to talk about tonight. So we've made it easy on the vaccinations. Please do that. Full list of clinics is available online at www.backtoschoolri.com. And our groups are making vaccination as accessible as possible. And there will be a universal masking in schools. And we made sure air quality and circulation is a priority. Testing will be available. We're all following all the CDC and Department of Health recommendations to ensure success for our kids to stay in the classroom all year long. You know what? I'm a parent. Susan and I raised a couple kids. They're a little older now, but I still know that what we want for our children is not only a great education, but we want them to be safe. And so parent to parent, I understand your concerns and hope that you and your families will be at ease after hearing from leadership this evening. And with that, I'll hand it over to our Commissioner Infante-Green.
Thank you, Governor. Thank you, everyone, for joining us as we get ready to go back to school. Thank you especially to Governor McKee for being here and leading the state over the last 5 months. Because of your efforts, Governor, we all know that the vast majority of our teachers and staff returning to school have been vaccinated and ready to ensure learning continues. As you know, Governor, when we were going through the vaccine clinics, the teachers felt like they got the golden ticket. It was pretty amazing that they were prioritized. I know it's that time of season. It's hard to believe that summer has gone by, and the first students in Rhode Island will go back to school later this week. And just over 3 weeks ago, the whole state will be back, all in person. RIDE and the Department of Health and the Governor's Office have been working together to ensure that students can return to classrooms safely. We've been working diligently. During the 2021 school year, Rhode Island was one of the safest places for our students and staff regarding COVID-19 exposure. That was possible only through the hard work, not only through our public health experts, but the incredible school staff on the ground who worked tirelessly to keep our students safe through layered mitigation. I want to recognize our incredible teachers across the state who have risen to the occasion spectacularly. Your hard work has kept our students engaged, learning, growing throughout the pandemic. None of this would be possible without you, and we have the utmost respect and admiration for your work. Every time I visited the classrooms, the teachers said that they were happy to be back with their kids. They missed their kids. I know full well that being a teacher is a difficult job under any circumstance. We pursue careers in education for the reward of seeing the students grow and succeed, and it was especially difficult through the last year without that opportunity to actually see them in person in many cases. I want you to know that RIDE sees what you've done, the teachers, the administrators, the work that you have done. And I know that the parents and the students see the dedication and the tenacity that you have shown keeping our schools safe, healthy, and learning during these incredible times. More importantly, I want you to know that the students see you. Despite all the disruption that has taken place, you have been leaders. You have made it okay for our students. They know that things will be just fine with you leading the way. Parents, I want you to give yourselves a warm applause because You guys made a very difficult situation during this pandemic still work for your kids. So I want you to know that you have been partners in a very different way in this last year. And now you'll be able to send your kids back to school knowing that they'll be safe and able to enjoy the academic and social benefits of learning in person. I have heard from you countless times how important it was to have your students back in person. The most important tool that we have right now to prevent the spread in our schools is the vaccine. Governor McKee has done an amazing job of getting shots for our teachers. Over 90% of our teachers are now vaccinated. And the health department has also gone across the state to get our students 12 and older vaccinated. You heard from the governor, we have a list of all the vaccination sites locally. If you still haven't gotten your child vaccinated, anyone that's 12 and over, there is time. Please go to one of these sites, visit our website, and you will see all the information. However, what we're looking at is that many of the students still have not taken advantage, or basically the parents have not taken advantage of the vaccinations at this point. If you're still on the fence about getting vaccinated, talk to a healthcare professional. This is the time. We want you to have the best chance for your family to get protected, and it is the vaccine. I vaccinated my 13-year-old, and we talked about it. I talked about it with my son, made sure that he felt comfortable, and we went and we did it as a family. Very important. But RIDO has gone above and beyond and partnered with our local education agencies to provide back-to-school vaccination clinics in all 39 cities and towns in Rhode Island. That's important. We've brought it to you. We're working closely with your school system to ensure that school buildings are safe too. Every school submitted a health and safety component to their back-to-school plan. RIDE and RIDO have been working with them to make sure that those plans are comprehensive, accurate, actionable, and that they are successful. When it's ready, your school plans will be available at backtoschoolri.com. That's your one-stop shop for any information you need about education and COVID-19 safety in the coming school year. The latest guidance and schedule of school vaccine clinics are there available for you. Your districts have worked extremely hard to ensure that to secure the best learning environment for your children. No matter what happens, RIDE is here to help at any time, along with our partners at RIDO. We want your year to be successful, and we're going to be right by your side making it happen. Thank you all once again for joining us. I know that I've spoken a great deal, but we're going to get to your questions now. That's why you're here. Now I'd like to turn it over to Dr. Alexander Scott, that all of you know very well.
Thank you, Commissioner. Good afternoon, good evening. It's a pleasure to be here with the governor and Commissioner Infante-Green to be able to talk to you about getting ready to have an excellent school year this year. Kids are going to be in school with their friends, learning, engaging with each other. All of the steps that we know are critical and phenomenal. Now, as everyone knows, as we're doing this, COVID-19 is here. It hasn't gone away. It's going to be with us once school starts. There'll be cases. There'll be people who will need to quarantine, but we have the tools to make this year as healthy and safe as possible. We know how to do this. We've experienced it before, and we know how to make it so that, similar to last spring, there was very little transmission of COVID-19 actually within schools. That's because schools had the systems and requirements in place. They implemented it effectively. They enforced it, particularly when it came to mask wearing, testing, and distancing. Schools are going to be replicating what works again this year. They'll have you all as parents and families to engage with and help support in their compliance. Everyone knows what to do, and we have one additional tool in our toolkit, and that's the vaccine. While we know that not all school-age children can get vaccinated against COVID-19, If your child is older than 12, he or she should definitely get vaccinated. That's the best way to help your child, to help your child's school, to help your teachers and everyone in avoiding interruptions this year and making it so that it can be a year focused on fun and learning. It takes about 5 weeks from the first shot until you're fully vaccinated and protected. So it's important to sign up to get your first shot now if you haven't already and you qualify. I mentioned masks earlier as well. Masks work to limit the spread of COVID-19. It's an actual barrier that has been extremely effective in decreasing the spread of respiratory viruses like coronavirus. The protection works best when everyone is wearing one. All K through 12 public schools are required to have a universal indoor masking policy in place at the start of this academic year, which is great news for being able to be confident that things are going to go well. And I've been so impressed with our students and our kids. They have done a great job in looking at how it was handled last year and being able to mask comfortably and allow that to gain everything they can gain by being in person with in-school learning this year. Another important reminder is that kids and school staff have to just stay home when they have symptoms. Contact a healthcare provider for testing and care if symptoms arise. We have a great system in place statewide that we want to continue to maximize. It's also important that student athletes know that they should stay home and stay out of practice and competition when they have symptoms. It's definitely not the time to just tough it out and compete like it may have been normal to do before COVID-19. If we want to make it so that all of the school extracurricular activities and athletic activities that we know are so critical are able to occur effectively, it's with everyone complying. If you have symptoms, to stay home and not bring that around the other athletes or other students and teachers that you're engaging with. Getting everyone in the household tested is important if kids or someone else at home has symptoms. That's an important message. School-based testing is available. It keeps students learning in person and active in extracurricular activities by finding asymptomatic cases early. Cases that don't have symptoms, testing is a great way to help identify that. This way you can prevent outbreaks and protect people who may be at increased risk, such as children, school staff, and family members with underlying health conditions. Masking, vaccination, and testing are excellent tools, and we add that to the work that we do at RIDO, which is the contact tracing in support and partnership with our RIDE colleagues, together with isolation and quarantine, another critical tool that works to keep kids safe and ultimately everyone learning in person with the fewest disruptions. The state and all of our schools and school community, including you all, have the solution that we know can work. And so with that, we know putting those in place, implementing them will make it so that we're able to have a great year. With that, we will jump in with some of our questions. I'll pass it back to the Commissioner.
Thank you, Dr. Alexander Scott. And we know that it is about mitigation, and layering and layering and layering. So we have a lot of tools that we did not have last year. So we're in a good place. We're going to kick it off with the first question for our governor. Governor McKee, what are your expectations for the upcoming school year? Governor, you're on mute. Governor, you're on mute.
Thanks, Commissioner. Or you think we'd be used to this by now? No, I think the expectation is all 39 cities and towns open with their schools safely for our for our students and our families know that it's safe. And then make sure that the opportunity of the recovery, we know there's some recovery that's going to go on because of the abbreviations in many of the ways of last year. And we want to get right to work. So it's good. It's, I think that the expectation is, a really very joyous and fun, experience for our students. They're going to be back together and in a way that's going to be good for them. And I think that the enthusiasm is going to really carry over into the classrooms. Certainly I'm not going to speak to the education. Our teachers got that under control. Your office does as well. Dr. Alexander Scott's got the health issue. My expectation is that you're going to have a very successful school year for the families that live in the state of Rhode Island.
Thank you, Governor. Now for our first question for Dr. Alexander Scott. Doctor, lots of folks have questions about masking. Robin from Cranston West, Russell from Garden City, Melanie from Rhodes Elementary, Michelle from William DeBate School, Elizabeth from Thompson Middle School, Sophia from Hathaway Elementary School in Portsmouth, and several others. Everyone wants to know what are the science and data which support masking kids inside schools to help stop the spread of COVID?
Thank you, Commissioner. I'm always eager to talk about how effective masks are. And over time, we've continued to have an accumulation of data and science to support it. And it's clear that masks work to limit the spread of the virus, coronavirus, that causes COVID-19. It is really the basic science. Masks stop the spread of the droplets through which the virus is spread. And it limits the spread of those particles, those respiratory droplet particles, when someone breathes out. That then leads to it limiting the intake of droplets and particles when someone else around them breathes in. This protection works best when everyone is wearing a mask. A mask works to really show that you care about the person that you're exposed to, because even if you don't realize that you have coronavirus or one of the respiratory viruses, a mask will prevent you from unknowingly spread the virus that causes COVID-19 to someone else. So everyone wearing it really helps in limiting it, especially with the Delta variant strain, which is significantly more transmissible. All the more important to use masks in this situation. Local, national, and international data have shown that masks help limit or prevent the spread of COVID-19 in schools in particular. In Salt Lake City, data show 20 city schools with high mask use and testing had low levels of transmission despite a high level of community transmission. In Georgia, data show that K-5 schools that required teachers and staff members to use masks had 37% lower case rates than the schools that did not. Sadly, we also see the other side of this coin. Right now, there are schools across the country with either relaxed or no masking policies that are seeing outbreaks of COVID-19 within that school setting, associated with that school setting, causing significant disruption. Many of them now are planning to implement a universal indoor masking policy because it's such a simple change that makes such a dramatic difference and really impacts our whole society. Kids can go to school, parents can then go to work. We can make sure our kids are getting the education that they need. We've seen it in Texas, where at least 4 school districts have already closed temporarily due to COVID-19 outbreaks where masks weren't required, and then more than 5,500 students and more than 316 employees in a school district in Central Florida, which didn't require masks, are now quarantining or isolating those large number of individuals due to an outbreak of COVID-19, which is extremely disruptive. And in response, the school board there is considering what we've already done, which is implementing a mandatory mask policy for our schools. The bottom line is masks work, kids have been amazing in using them, and it means the rest of our society, schools can function successfully with significantly less disruption, and our economy can function because their parents can now, go to work and be confident that their children are getting the education that they need. So that's a critical piece. I get to pass on a question to you, Commissioner. Tammy in Cranston asked us, what can be done to provide distance learning options to children who have medical issues and are high risk if they return in person for school? What distance learning can be provided?
Thank you for the question, Dr. Alexander Scott, and thank you for the question, Tammy. So remote learning is one of the options for families that are at increased risk of severe illness or those with special health needs. Those who live with people in high risk, that have high risk or are experiencing long COVID. These children may be eligible for special education related service under federal law. Parents should meet with the district and review their health plan, 504 plan, or IEP. However, we know that from last year that schools are a pretty safe place for our kids and they benefit from the academic and social benefits of being in person. However, if this child has medical issues or is medically fragile, the decision on how to provide distance learning is up to the district, how they're going to provide it. That they should is what the parents have available to them. They should go meet with the district and have that put in place for those students that fall into that category. Thank you. So now we have a question. Cindy from Martin Luther King Elementary School and Denise from North Situate Elementary School ask about school lunches. Since Delta variant spreads more easily than other strains, how will kids stay safe during lunch, especially when the masks are off and when they're eating and drinking? Dr. Alexander Scott, this is a question for you.
Thank you. This is a straightforward one. We strongly recommend that students and staff just eat lunch outside whenever possible. Having ventilation that allows for air to move actively is an excellent way to help minimize the spread of the virus. For days or situations when they have to have lunch inside, schools can use strategies to improve ventilation. We did a tremendous effort last year to help support that for all the schools needed, to maximize physical distance, to wear the masks indoors, and to have frequent cleaning and promote hand washing where that's possible. So we can be confident that kids can enjoy their lunch safely. They're outdoors or indoors with those mitigation steps in place. So I'm going to pass on another question to the Commissioner. Pam in West Warwick asks, my child has significant speech delay, specifically a diagnosis that's a processing disorder and articulation impediment. He is 6 years old and going into kindergarten. His doctor has given us a note to exempt him from mask mandates. Are exemptions allowed?
Sure. Thank you, Pam, for the question. Families should work with their local school leaders in the district to see what their policy is. Obviously, there's always an appeal that can be made to the commissioner's office. However, aside from legally required accommodations, there are accommodations always. Reasonable face mask mandates will be enforced by the school leaders in accordance to the Governor McKee's executive order. But if your child has special needs, that's something that you can work with your district. There are always some exemptions that are allowed based on medical needs. So that's the answer. So doctor, here's another one for you. Jeffrey from North Situate Elementary School asks, what are the plans for regular testing of asymptomatic students? Will this be employed to help with every identification of outbreaks?
So yes, we love talking about the tools in our toolbox. We absolutely know about vaccination. We know about masking. There's also testing and treatment. And testing is something that we've continued to lead the nation in, and it's been a valuable resource, particularly in our K through 12 setting. At a minimum, our recommendations for testing are in line with the CDC recommendations, where anyone who is not vaccinated should absolutely be screened for testing. We certainly encourage asymptomatic screening or testing for all students, for all family members as well who are interested in the pre-K through 12 school communities, with the particular focus on those who are not age eligible for a vaccine or not fully vaccinated. Places like Rhode Island that currently have high levels of community transmission recommends weekly screening testing of at least 50% of the students that are not fully vaccinated. And like I said, we already have the capacity in place. And so anyone interested or any school district interested in recommending testing for those fully vaccinated would be welcome to do so as well. When students or others have symptoms of COVID-19, it is important, again, to remember that they should isolate from other people in the home as much as possible and get tested right away. Stay home, isolate from folks in your home, and get tested right away, even if you're fully vaccinated. So testing is a critical tool that we always want to continue to make sure is available. So I have another question that I'm going to ask of the governor, actually. Governor, so far we've heard from many parents with questions about the school year. As a father yourself, what's your message to parents around the state preparing to send their children back to school?
Thank you, Doctor. And so I think the message to parents is, one is both Dr. Alexander Scott and the commissioner and I, from a safety point of view, really heavily recommended that all districts in the state adopt a mask policy. And virtually everyone has. Those who haven't, we put together a mask policy to cover the districts that had not adopted one. So from a safety point of view, and the things that the doctor just mentioned in terms of ventilation and other measures, safety is a high priority. So parents should feel very comfortable with that. I would also say that we know a lot more today than we did at the beginning of last school year. We know that there's been improved areas in science and data. And so you should be able to rely on the fact that there's been that level of improvement. And the state of Rhode Island, as the doctor said, has led the country and most of these areas, as Dr. Alexander Scott, testing and that type of effort, along with the vaccinations, which we're a national leader there. So we know a lot more. I wasn't around the beginning of school last year, but I know a lot more now since March. And our team that's here has been here since last year. They know what is going on. So the message to the parents is, get your kids in school. It's going to be a safe place. And then really engage with them this year in a way that's very proactive in terms of their learning process, connecting in with your teachers, connecting in with the administrators. This is going to be a really good opportunity, as I mentioned before, for students to be recovering on some of the learning and also excelling. So I would say this is going to be a really good year. The schools are ready. That it's going to be safe for your children, and it's also going to be very important that you play a real important, an active role this year. I've read that in this particular year, coming about after COVID, this is the year where we can gain the absolute most in terms of education value for our students that we've seen probably in a lifetime. This is the moment where parent engagement would be very, very important, and knowing that the safety of your children is a top priority, both of the Department of Health and RIDE and your local districts, who have stepped up to adopt safety measures that are going to help keep your children safe.
Great. Our next question comes from Jen in Newport. Will social distancing recommendations be followed in elementary schools since the children are not eligible for vaccine? Jen, that's a great question. When students under the age of 12 are not in stable pods, we recommend that the school implement at least the 3 feet between the students. But we recommend that elementary school really look at stable pods as much as possible. But when they can't, that they should have the 3 feet. For stable groups at elementary school for fall, for kids 12 and older, social distancing is not necessary. For the ones that are not being able to be vaccinated, it is really important to have those stable pods. If not, 3 feet. So that's the rule. Thank you. So doctor, we have a question for you. Carissa at Washington Oak Elementary, Kate from Adequaneck Elementary, and others asked us, why does the CDC guidance offer an exception for K-12 close contacts?
Thank you for that question. It allows us to highlight the fact, similar to what the governor mentioned, that along with many aspects of this pandemic, our understanding of how to most effectively use quarantining as a tool has evolved. We know it's critical to do it in a way that minimizes disruption. And transmission inside schools across the country has been studied extensively, and we know how extremely low the risk of transmission is within schools. The CDC guidance takes that into account and has allowed for an update to the definition of close contacts for students in pre-K through 12 classrooms. Inside of pre-K through 12 classrooms, students that were within 3 to 6 feet of another student infected with COVID-19 for a total of 15 minutes or more could be exempt from quarantining as long as universal masking is in place, along with the other mitigation steps that we have asked schools to put in place. This exception only applies to students inside the K through 12 classrooms because the CDC has the data to support it. We've asked schools to continue to help us at the Rhode Island Department of Health, along with RIDE, determine which individuals are close contacts. In this way, we'll continue to communicate with close contacts about quarantine, testing, and treatment with the idea of keeping people safe, minimizing transmission of COVID-19 within schools, and allowing for the fewest disruptions possible so that students get to enjoy their time learning this year. So with that, Commissioner, we can go on to the last question, if you'd like. Emily at St. Rose of Lima asks, are you going to mandate masks for private schools?
No, the current mask mandate does not extend to private schools. However, we continue to strongly recommend a mandatory masking policy in our guidance to private schools, and hope that they will take the necessary steps to keep their students safe. This is all about safety, guys. So even though we're not mandating in private schools, we hope that you will follow the guidance. Okay, Doctor, we have the last question actually will be for the governor. So the last question is, Governor. I'm sorry, looking for the last question here. What is your message, Governor, for our parents and students in the state of Rhode Island?
Yeah, so let me just talk to the children out there, the students out there. I want to, really recommend that if you have any concern or if you're afraid to be potentially going to school, talk to your parents, talk to your grandparents, talk to you when you're on the doctor visits or when you're getting vaccination. Nurses are going to be providing the vaccination for the young children that are 12 and older. And talk to your coaches. They're going to give you good guidance. They're going to give you what you need in terms of really feeling comfortable that you're going back to school in a way that really you're going to enjoy. And it's going to be important for you to get back there. Same message to the parents. Make sure your children have access to, if I'm walking through a school, please come up and say hello to me and ask me questions, or the commissioner or Dr. Alexander Scott. Connect in with the people that are in your lives that are important to you, your grandparents, your parents, your older brothers and sisters, your doctors, and people at the Boys and Girls Club. Talk to them wherever you are with with people that you really respect and that you admire. Talk to them, get their guidance. They're going to give you what you need to feel as though this is going to be just a great year for you, and that's what we're looking forward to. Dr. Alexander Scott, in terms of the health protocols that are being put in, really important, and then of course the commissioner and all the school departments through their administrators, the teachers, and the support staff. They're ready to help you learn this year, help you have a good, a lot of fun with your friends. And isn't that what we want? We want everybody back together and feeling as though that they're part of a community and that's what you are. You're part of a school community. Take advantage of making sure you talk to everybody, and then support your friends, support the young kids, the people that you're friends with. Let them know that they should feel comfortable talking to people that can help them through the beginning of the school year.
Thank you, Governor, and thank you, Dr. Alexander Scott, and thank you all for joining in, for sending questions. And there will be information on Back to School RI that will probably answer any other questions that have come in. And we look forward to this school year. Thank you all.